Kama paa tumepaa juu ya paa, tutapepea tutapaa.
Kaunti nambari 17 katika taifa la Kenya baada ya kuwepo kwa serikali za kaunti chini ya mwavuli wa katiba mpya ni kaunti ya Makueni. Sekta ya afya ikiwa ni moja kati ya sekta zilizogatuliwa kutoka serikali kuu na kupiga hatua kubwa kuimarisha afya ya mwananchi. Jumla ya hospitali 236 kuanzia kiwango cha hospitali ya rufaa yani level 5, sub-county level 4, zahanati na zile za kijamii zimeimarishwa kutoa huduma za kiafya katika kaunti ya Makueni. Kabla ya kuwepo kwa serikali za kaunti, hospitali 109 pekee ndizo zilizotoa huduma za afya katika kaunti ya Makueni, huku kufikia sasa enzi za ugatuzi jumla ya hospitali 236 zikiwezeshwa kutoa huduma za afya kwa ufadhili wa vifaa, wafanyakazi na pia majengo mapya na serikali ya kaunti ya Makueni chini ya uongozi wa gavana Profesa Kivutha Kibwana.
For me, when discussing devolution, I usually say that some of the most important events in this country were independence, of course, 1963. Then the 2010 constitution, and within that constitution, devolution. Those three events are so critical in terms of our history. Devolution has the potential to ensure that development is spread throughout the country. And after a short while, we stop talking about marginalized areas. So the more the national government cooperates with the subnational governments or the counties to promote devolution so that there is even development in all spheres, particularly those spheres that are the functions of counties like health, agriculture, and so on, the more our country will be stable.
One thing that we've been able to do in Makueni County is actually to look at development holistically, not touch only making sure that people are healthy without getting to understand the social determinants of health. We've been able to look at the social determinants of health and respond to those social determinants.
In keeping with our mantra of wanting to make Makueni a county of medical tourism.
This idea of medical tourism was beginning to take root, is beginning to take root.
Tumeona mabadiliko makubwa katika hospitali yetu. Ilikuwa ka hospitali lakini sasa ni hospitali.
Hospitali ya rufaa ya Makueni mjini wote ndiyo hospitali kubwa zaidi katika kaunti ya Makueni, ikiwa na uwezo wa kutoa huduma za afya kwa wagonjwa wa magonjwa mbalimbali kikiwemo kitengo maalum cha mama na mtoto, yani Mother and Child Hospital. Katika hospitali ya mama na mtoto tangu kufunguliwa kwake rasmi na serikali ya kaunti ya Makueni, zaidi ya wagonjwa 10,000 kufikia sasa wamepata huduma za kiafya.
What happens in the Makueni Mother and Child Hospital, it's where all deliveries and any other women-related issue are attended to. So in the department we have a labor ward, we have a twin theatre, we have a post-cesarean ward, we have a postnatal ward, antenatal ward, and we have a gynecological ward, and where the babies are kept when they have an issue, they are sorted out by the pediatrician. It's the newborn unit.
Isitoshe, uwezo wa kutengeneza gesi umehakikishwa na tayari mtambo wa kutengeneza gesi upo katika hospitali hii, yani oxygen plant, ambayo gesi hiyo pia usambazwa katika hospitali zingine katika kaunti nzima.
We have our own oxygen plant within the hospital. This plant is able to supply oxygen to all our inpatients in all the departments of the hospital. The oxygen plant also has a refilling model. This refilling model or module is able to refill 30 cylinders of 8.5 cubic meters every 24 hours. So in this area, therefore, we are able to sustain the other sub-county hospitals with supply of oxygen from our plant.
We have also done a blood transfusion satellite unit at the headquarter here, County Referral Hospital, And this supplies all our theaters and hospitals with blood for both patients who are ailing from anemia and those who have been involved in road traffic accidents and they need blood, the ones that have been operated and they need blood. Previously, we had to really scavenge for blood and borrow blood literally from Taita Taveta County and Machakos County, and sometimes they don't have enough. So our patients would not be in a good position during those periods. So this has really sorted us out, and we continue to equip the blood transfusion unit to a time that we will be able to screen our own blood within the county, and we don't have to make reference to any other institution.
When we started, we did not have so many patients. In fact, we started with one patient. And then after a month, we had 2 patients. The number went increasing day by day, up to this point when we have 18 patients who are on regular, despite the emergencies we handle in between. Before this unit was opened, our patient used to suffer because they used to travel from here to Kenyatta for dialysis. I think Kenyatta, Nakuru, and Mombasa. I think those were and the MTRH and Eldoret. Those were the only hospitals, the big hospitals with the dialysis centers. So the patient in counties, they used to suffer a lot. They used to travel from here to Nairobi, and they remember that Nairobi, the patients are coming from different counties. So these county renal units have really helped our patients completely. We can say that we have achieved, because they really appreciate the accessibility, cost-friendly. They can do their work, because most of them, they come from all around. So if they come, we do dialysis after 4 hours, they are off home, they do their activities, they come, so it is cost-friendly.
We have also been able to set up a health products and technologies directorate, which I'm the head, and this one has been a first in the country. We are the first county to set up that directorate, and we have seen many benefits from that move or that setting up of that directorate. A key among them is that we were the first county to have an active medicines and therapeutics committee in the country, and this is a committee that ensures that there's a platform where all technical people who are handling health products and technologies bring their heads together to discuss on interventions that can be put forth or that can be implemented to ensure that there is efficiency in the utilization of health products and technologies.
We have also done a trauma center, which is something that the national government had planned to do since independence because of the busy Nairobi-Mombasa highway, but that never happened. We were able to set up that trauma center. We have an ultra-modern CT scan, 64 slice, that you don't easily find them in the public health space. And double theaters, we have surgeons there, general surgeons. We have the orthopedic surgeon who is doing very interesting work, including knee replacements, total knee replacements. These are things that previously have only been seen in the private hospitals, but now we are able to do that for our patients.
Sio hospitali pekee inayotoa huduma hizi. Kupitia serikali ya kaunti ya Makueni sasa, wakazi wanaweza kupata huduma hizi katika hospitali 11 za sub-county, yani level 4 hospitals, ambazo ni Mbaoni level 4, Tawa, Kisao, hospitali ya Matiliku, Mukuyuni, hospitali ya Kilungu, hospitali ya Sultan, Makindu, Kambo, ambazo ni hospitali 11 za level 4. Kama njia ya kuwawezesha wakazi wasio na uwezo wa kujimudu kifedha, serikali ya kaunti ya Makueni chini ya uongozi wake Gavana Profesa Kivutha Kibwana ilibuni mpango wa ufadhili wa matibabu wa Makueni Care wa shilingi 500 tu kwa kila familia kwa muda wa mwaka mmoja.
Since the introduction of Makueni Care, the residents of Makueni have really benefited. It's only 500 per year and you get all the services which can be offered here in Kibwezi, can be offered in Makueni County Hospital. The card has really helped the residents of Makueni.
Kuna hii universal health care tunalipa, tulikuwa nayo tangu 2013 2015 hapo ikakuja ya kwanza, tukarenew tena, tukarenew. Yani wewe ukija tu hata kama huko umerenew saa hizo, before uanze kutibiwa unaingia hapo, unarenew hapa within 15 minutes umerenewiwa, unatreatiwa bure, unabeba dawa, unaenda nyumbani. Sisi siku ile tulikuwa tunafanya harambee za hospitali.
Kabla ya devolution government tulikuwa na shida kubwa katika hii hospitali. Kitu cha kwanza kulikuwa na shida ya madawa. Ukija unaandikiwa card, unaambiwa unaenda kwa chemist ukanunua dawa. Na watu wengi kwa sababu ya ukosefu wa pesa walikuwa wanaenda bila dawa, na wengine walikuwa wanakufa sababu ya kukosa pesa ya kununua dawa. Na kulikuwa na vitu vingi ambavyo vilikosekana katika hii hospitali. Siku hizi vitu vya kupima watu wagonjwa zimekuweko. Dawa imewekwa chungu mzima. Ni nani kuambiwa uende ukanunue dawa nje. Na kuna hii card ya account. Hiyo pia imesaidia watu sana. Wengi mtu akinunua hiyo card akilipa pesa atibiwa mwaka mzima bila kulipa chochote. Wale wazee kama mimi na 68 years, hii card imepewa bure. That is an advantage to the devolution.
Like hatukuwa na source of power. The facility was not fenced during that time, but with Makueni County we have been able to get solar power. Initially, before we had the power, we could not. There were services which we could not offer. For example, like the maternity services, they were not. We could not do those services at night because of the challenge of power. Also, during that time, we did not have the lab services. Currently, we are offering lab services for our ANC mothers and for the other clients who come to the facility.
We also have a powerhouse with a generator, a modern generator, and also we have a generator which uses fuel, which actually alternates with electricity from the Kenya Power and Lighting Company when we have a blackout. So the hospital is supplied 24/7. We have no issue with the power in the hospital, whether we have power outage or not.
Before devolution, the ambulance services in the county did not have a central command. We were operating with 5 ambulances and there were no emergency medical technicians. So we had a lot of maternal, neonatal mortality rates. But after devolution, the county has been able to procure 20 ambulances, which are evenly distributed in the 6 sub-counties and also invested in human resource. As I speak, we have 8 EMTs employed by the county. We also have an operational emergency operation center, that is the call center. We have a central chain of command for the ambulance services in the county. We have been able now to have a response time for every emergency of less than 30 minutes. That is saving lives and more so having a quick access and response to emergency cases in the county.
Women are farmers and farmers are women. 75% or even 80% of the food that is grown, and knowing Makueni is an agricultural country, is actually grown by women. So how do you expect a woman whose hand has been broken to feed the family? How do you expect a woman who psychologically and emotionally is not happy to actually take care of a family. How do you expect a mother, a wife, who is responsible for taking care of the older people in that family, who has been violated, constantly being beaten, really be able to actually take care of that family? So we see sexual and gender-based violence as a development issue, and that's why as a county we established a gender recovery center. We also have a safe place. During the lockdown at the beginning of COVID-19, there were cases of women that are violated during the night. They come from Kakamega, they come from Machakos, they can't get to Nairobi, they can't get to Mombasa. Therefore, we actually established a safe place, and we saved quite a few women.
Jumla ya vyumba 14 vya upasuaji yani theater zimewezeshwa kutoa huduma kwa wagonjwa mbalimbali katika kaunti ya Makueni, ambapo awali ni vyumba 3 vilivyotoa huduma hiyo.
The services by then were so limited because there was no theater services. There were no X-ray services. There were no even maternity services. They did not have a modern maternity. So post-devolution, when we came in, devolution has actually improved so much. If you look at the sub-county hospital, currently there is a new maternity wing which is able to serve an average of to around 150 deliveries, that is per month.
Kufikia sasa huduma za X-ray zinapatikana, ambapo serikali ya kaunti ya Makueni imewekeza katika vituo 10 katika kaunti nzima kutoka vituo 2 vya zamani. Kufikia sasa kaunti ya Makueni imeafikia sheria ya shirika la afya duniani WHO ambalo hitaji kuwepo kwa kituo cha afya baada ya kila kilomita 4.5.
The average walking distance to the nearest health facility has improved. Before devolution, the average walking distance was 9 kilometers, and we have added infrastructure by building new dispensaries and renovating others that were installed under the old county council, and this distance has reduced to an average of 4.5 kilometers, which is within the WHO recommendation of 5 kilometers.
Hata hivyo, kufikia sasa serikali ya kaunti ya Makueni imewekeza zaidi kuhakikisha wagonjwa wa macho hawasafiri mbali kupokea matibabu. Huduma kama hizi pia zikitolewa kwa wagonjwa wa meno, ambapo pia serikali imewekeza zaidi. Wagonjwa mahututi wanaohitaji huduma za ICU sasa wanapokelewa katika hospitali kuu ya rufaa ya Wote, ambapo pia ndicho kitovu cha matibabu ya wagonjwa wa COVID-19. Isitoshe, serikali ya kaunti ya Makueni imehusisha jamii kuimarisha afya kupitia mpango wa Community Health Strategy.
We had 91 community health units, and from 2013 to date we have increased that number to 219 through establishment of more units in training community health volunteers. Community health volunteers are a human workforce who work in the community, assisting community members in matters pertaining to health.
Serikali ya kaunti ya Makueni vile imefungua vituo vya ushauri na saa, yani counseling units, katika hospitali mbalimbali.
Makueni County didn't have a counseling program. We didn't have a counseling unit. So immediately the devolution brought us to Makueni. We realized that there was a void, and we realized that through the hard way. There was the cancer care problem of where people drank illicit beer, illicit alcohol, and we lost many people, and some of them even became blind. Then that was followed again by the Garissa incident, where we lost about 30 people from the Garissa incident. And then also we had the Fwake problem where we had an accident and many people were hurt. And in all these 3 incidences, people were very much traumatized. And that's when, especially the first incident, we have to revert to our councillors outside this county because we didn't have a counseling unit. And it was not only cumbersome, but also expensive. We had to source from Nairobi, from Nakuru, and from other parts of the country. And we realized through that actually there was a need for a counseling unit in Makueni County. And I'm very happy that when I sold this idea to the county government, they bought it, they had the goodwill, and we started the journey to form a counseling unit. We started with 10 counsellors and 1 unit head for 1 year, and then we upgraded to 15 counsellors and 1 unit head, and now we are at 18 counsellors, that is inclusive of the unit head.
Usimamizi na udhibiti wa taka na uchafu katika hospitali nyingi humu nchini ni moja kati ya changamoto kubwa, ila katika kaunti ya Makueni moja kati ya mitambo 5 ya kisasa ya kuteketeza taka nchini inapatikana hapa.
Hatukuwa na chumba cha kuchomea ama incinerator, tulikuwa tunachomea uchafu nje, lakini wakati county government ilikuja, county government ya Makueni ilitusaidia, wakatujengea nyumba, wakatuletea mashini ya kuchoma uchafu. Kwa hivyo siku hizi uchafu wote wa kutoka kwa hospitali na hata mahospitali ingine ya kaunti mzima yote yanaleta uchafu hapa. Kwa hivyo uchafu unachoma kwa hiki kifaa, kisha ikikuwa njivu kuna mahali ambapo pametengenezwa mzuri, tunaenda kuweka huko.
On human resource for health, in 2013 we only had about 977 healthcare workers working for the department. We have continuously improved those numbers, and currently we have 1,504 workers.
The staff are motivated. Like an example is timely salaries and good environment. That is working environment.
Ushirikiano na umoja baina ya wafanyakazi umesaidia kuimarika kwa sekta ya afya katika kaunti ya Makueni.
Clinicians, the nurses, the support staff and members of the management team.
Makueni County Referral Nurses, we dare to care.
Wagonjwa wa saratani wamefaidika pakubwa kutokana na kuwepo kwa kituo cha saratani cha Makueni Cancer Center ambacho kimeimarishwa na ufadhili wa serikali ya kaunti ya Makueni kwa ushirikiano na mashirika mengine. Shirika la Amref ni moja kati ya mashirika makuu yanayoshirikiana na serikali ya kaunti ya Makueni kutoa mafunzo kwa wahudumu wa jamii wa kiafya, yani community health workers. Shirika la Philips pia limesaidia pakubwa kwa miundombinu ya kisasa kwa kuwezeka mitambo ya umeme ya sola katika baadhi ya hospitali za kaunti ya Makueni. Aidha, usafi umedumishwa kwa kiwango cha hali ya juu katika hospitali zote na kutolewa kwa huduma za chanjo kwa wakati ufaao.
Before devolution, Makueni County had around 119 immunization sites. But then after devolution, the sites have grown to 276. And this growth can be connected with the devolution because the county was able to acquire additional vaccine fridges, and that was supposed to store vaccines for these immunization sites. The county was able to employ additional staff who would work in these additional vaccination sites. As well, the county acquired some other equipment and other support to the sites. For example, the motorbikes were acquired and were distributed to the community health extension workers and some of the community health volunteers. This is assisted in carrying out outreach in various outreach areas in the hilly areas, which were prior difficult to access immunization sites or immunization services in Makueni County.
Huku pia njia ya kidijitali ikitumika kusajili wagonjwa. Hata hivyo, serikali ya kaunti ya Makueni inaendelea kuwekeza zaidi katika sekta ya afya, ikiwa ni pamoja na ujenzi wa hospitali mpya na vitengo mbalimbali vya kuimarisha afya.
This is a 200 bed facility that we will use for specialist care of COVID patients. And when COVID dies down and we don't have to utilize that facility for the same, it can still be used for general wards for our patients. This facility will also have labs inside. It will have offices inside. And basically, it is a facility that is envisioned to continue serving this county for the next 30-40 years.
We're coming up with what in Machakos they call it Ward 9. Ward 9, a mental, a psychiatric, and we have already the superintendent in Makueni Referral Hospital is a psychiatric doctor. So we are actually in the process of completing that unit, so that we do not refer people in Mathare, we do not refer people to Machakos. So soon we will commission it.
I think as we move forward, we have to make sure that we invest more money in health, particularly because as of now we're investing slightly over 30% of our budget on health matters. And health was one of the most decentralized function because of the dispensaries at the level of the village, so to speak. So we will need more money, and if in the next government after the elections, if it is possible, using the constitution that we have, even without having to change the constitution, to make the money going to devolution more, because that is possible. The constitution simply says what is the minimum, which is 15%. It doesn't talk about the minimum. So even 35%, 40%, 45% can be increased using the current constitution. If that was to happen, so that now more money can go into health, that is when in Makueni, for example, I can foresee that money being used to promote community health strategy.
Mafanikio ambayo yamewezeshwa na miundombinu na mipangilio iliyowekwa na serikali ya kaunti Makueni kupitia sekta ya afya, ndio maana wanafunzi wa Mwani wanasema
Withugatuzi, kama paa tumepaa juu ya paa, tutapepea tutapaa. Shwa.